Good morning, everyone. My name is Erica Richards, and I am on the board of the Fairfield Media Center. And as part of a series to help inform our public about what's happening with the COVID-19 pandemic, we are interviewing very special people in our county who can offer us some information and how to best go about our lives in this current situation. I have with me this morning Christine Estel. She is the administrator for the Jefferson County Public Health Department, very busy person. Also, we have off camera and available for questions is Brett Farrell. He is the emergency manager for Jefferson County. Good morning, Christine. How are you doing?
I'm good, thank you.
How are you guys holding up?
I think we're doing okay.
Pretty busy. Yes. Well, just wanted to start out by saying how much we appreciate all that you're doing and that you were with us here this morning for a few minutes. I know you have a meeting with the governor coming up soon, so we will do our best to get this interview and get people informed quickly.
Great, thank you so much, and thank you for putting forth the effort to allow this information to be shared in this manner, so thank you very much.
You're most welcome. So let's just start with some basics. What is the difference between the flu and COVID-19?
The coronavirus, as we are currently experiencing a new strain, they've named it COVID-19 because it was identified in November, December of 2019. There are 7 different types of coronavirus. This is a new strain of the virus. 4 of the viruses are pretty nondescript. Oftentimes we've had them in our lifetime and they don't cause lots of problems. Mm-hmm. This one is related to SARS that we saw in the early 2000s. We saw MERS in the Middle East several years ago, and now we have this new strain of coronavirus identified as COVID-19. So when you compare influenza to coronavirus, it's 2 different things. It's like comparing apples and oranges, so to speak. Yes, they're both viruses, but viruses are very different and unique.
Very good. Thank you. And of course, we know that COVID-19 is very infectious, which is certainly different than the regular flu. The flu is infectious, but this seems to be a little bit characterized differently.
Right. And I think the thing is, since it is new, we just don't understand a lot about this virus. I mean, we're learning new things every day. And like other illnesses or viruses, you can be asymptomatic, meaning you don't experience symptoms yourself, but then you can carry those, to others and share it not knowing.
Right. And so that leads into the next questions about personal protection. If you could sort of give us a general idea of what people can do to protect themselves from perhaps if they are asymptomatic, going to work, going to the store, washing hands. People are using a lot of homemade masks. How often should they be washed? Things like that.
Sure. And the guidance that I'm sharing today is at 10:20 on April 14th. I had to look at the calendar because I don't know what day it is sometimes.
Sure.
Just know that the guidance that we might share later today or tomorrow could be totally different based on what's currently available through our state and federal partners. The best thing to do is to always practice good hand hygiene, meaning wash your hands. I cannot stress that enough. The other thing, when we talk about social distancing, it means to give yourself 6 feet of perimeter around you or a bubble around you, because when we speak, when we eat, if we sneeze, cough, we can share droplets of, and not even realize that we're sharing on a normal day, we're sharing things. And then if you're infected with the virus or influenza or whatever it may be, then you're sharing those things as well. That's why we encourage that 6 foot of distance or 6 feet of distance. The other thing, I know recently the CDC has recommended the use of cloth masks when you're going out in public. I know that if you're going for a walk by yourself or riding your bicycle, you don't need to wear a mask if you're alone. If you're out walking with one of your friends and you're not oftentimes we walk closer than 6 feet. Both of you should wear a mask, and that's to protect you and the other person. Those things we're just asking the public to help us decrease the spread of this virus. And those are simple things that you can do that make a huge impact on what will or will not happen in our community.
Sure. Now, recently in the news, I saw that there has been some, and like you say, things change quickly, that they are thinking maybe it travels further than they thought and that the virus can be carried into your home on your shoes. Would you have anything to say about that?
Well, as a nurse, I've tried to practice this my whole nursing career. When I come home from work, I kick my shoes off at the door, and I don't wear my work shoes into my home generally. Okay. I think we need to be more aware of that. I think, especially if you have toddlers, pets, other people living in your home, because you're going to track whatever it is you're carrying on the bottoms of your shoes. So kick them off at the door, kick them off, put them in the garage, or put them at the doorway when you first come home. I encourage people that are direct service workers to, take your scrubs off, throw them in the washing machine, jump in the shower. Those kinds of things can help keep your family members healthier. And you have to look at the issues that you may have in your own family and with their health issues, meaning if you have somebody that's immunocompromised, if they have an autoimmune illness like lupus or, something like that, rheumatoid arthritis, they might be on a medication to help with their symptoms, but the medication that they take might also suppress their immune system and they don't have the ability to fight. So those are some things that we can do that are so easy, and people just don't think about the impact that those things have. Wash your hands before you eat anything, obviously. When you bring your groceries home from the store, don't set the bags on the kitchen counter. If you do, make sure you wash the counter off. It's easy to mix bleach solution in a spray bottle.
Right.
Wipes, if you have availability to, Clorox wipes, which are in hot demand and on back.
Let me ask you about the proper use of gloves. I know that there is a science to wearing gloves, putting them on, taking them off. And I don't think that people generally in public know how to properly use gloves because there could be cross-contamination and you think that you're really protecting yourself.
Right. People do not. Even healthcare people sometimes struggle with it. I know the people that are the best at using gloves and appropriate PPE are the people that work in a sterile environment on a daily basis or involved in a sterile procedure. And those would be our operating room staff. Those would be those people that you're having a procedure done and you have a whole entire sterile field. You're in a sterile gown, mask, gloves, everything is sterile and you don't touch anything. And you're like, once you put on gloves, you're like, you're not going to touch anything.
Yeah.
So I think sometimes when we wear gloves, it gives us a false sense of, well, I can wear gloves and I'm fine. But you don't realize how much you're touching your face. If you notice, my hands are on my lap. Right now, because I have a tendency to talk with my hands and I have a tendency to touch my face. And if you have gloves on, your gloves can be highly contaminated. Yeah. And sometimes it gives you a false sense of, oh, I have gloves on, I don't need to wash my hands. Mm-hmm. So I can't caution people enough, regardless of whether they're wearing gloves, they still have to wash their hands.
Gotcha.
And you need to, everybody's getting hung up on the hand sanitizer situation. Well, it's in short supply, short supply. But at the end of the day, soap and water is still the best. Mm-hmm. Water is still accessible. Okay. And you don't have to have antibacterial soap. It doesn't matter what kind of soap you use, as long as you're using friction to rub your hands together when you're washing them.
Right.
And again, don't touch the faucet. Use a paper towel to, turn that faucet off. Don't use your clean hands to turn the faucet off. In nursing school, we actually had a check-off on how to, a lab check-off on how to appropriately wash your hands. And even though we're washing our hands, we don't do it correctly. Yeah. So I can't stress that enough. If you have little kids, you need to teach them proper hand hygiene when they're little, and then it just becomes a habit.
Yeah. Yeah. And I know that there are plenty of guides out there to teach people how to get into all the nooks and crannies. So thank you for that.
Yes. Yes. You're welcome.
So let's move into talking about testing. I know that Abbott Laboratories has just created a fast, quick test, 5 minutes. And rapid test, and I'm wondering what would the accessibility be to Jefferson County? I know we're rural, we don't have a lot of cases happening right now, but just so that we know in general, is that something we will have access to?
I think at this time, we don't know the answer to that. I know that it would probably go to a hotspot, meaning it would go to a county or a location that has numerous cases of lab confirmed COVID-19. The thing about testing, though, I can't say this enough. I know that we are a black and white. We want this answer. We want this answer. But to me, that I'm, quote, lab confirmed. See, there I go, talking with my hands. We get hung up on that, though. Your treatment is not going to be any different if your lab test says positive or negative.
Yeah.
If you're symptomatic, you're going to be treated based on your symptoms. So if you get COVID-19 and you just aren't feeling quite right, you have some of the symptoms, you don't have all of the symptoms, you need to stay home, isolate for the 14 days, follow the guidance, and then, please share that information with your place of employment and just go about your business, stay home, take care of yourself just like you would if you had any other virus. Now, the 20% of individuals that will become sick or, may need some type of higher level of care, meaning hospitalization or an ICU, those are different. That's a different story, but it's still going to be based on your symptoms as an individual.
At what point are symptoms indicated that they need to come to the hospital for extra care?
That would be, oftentimes when we get older, when we have a compromised system, meaning we have a comorbidity, we have, lung issue, we have, respiratory problems, a cardiac problem, diabetes, some other type of healthcare issue, it makes our body not be able to fight a virus.
Okay.
At a certain level. But again, it goes back to, if you're not feeling good, if your body is not, quote, normal for you, breathing, if you're having pain, if you're having, we all know what our bodies like as normal, and I can't, that's just your baseline. But if something's not right, and if you're having any difficulties breathing, you need to seek a higher level of care. I'm scratching my back, not my face. I will say that we still, unless it's life-threatening, we still want you to call the hospital locally to get screened, and they have a COVID clinic set up if you're symptomatic. And that, let me look at that phone number. That is 469-4180. Again, 469-4180, and that is here locally at our health center.
Wonderful.
And they have screening questions, but obviously if it's life-threatening, if you're short of breath, if you can't get your air, you're having chest pain, or things that would warrant a 911 call. And I know that our dispatchers at the law center have a set of questions that they are asking when someone calls 911. So it's kind of like a pre-screen question, and then that kind of flags your call to say, this person's having shortness of breath. It could potentially be a COVID case, FYI.
Okay, very good. So people really just need to know intuitively when things maybe take a turn for the worse and really pay attention to that.
Yes. Yeah. One thing too, right now, since it is spring and everything's getting green, which is nice to see spring weather and green and people are getting outside. If you have a history of seasonal allergies, take that into account now this time of year. I mean, if every year you have trouble in the spring, then treat your allergies accordingly with whatever routine treatment option you use, and then go from there.
Excellent. I wanted to throw a quick question to Brett. So could you explain quickly what your role is in this situation and how you interface and work with public health and Christine?
Sure. So emergency management, which is my job here in the county, we're tasked with the planning of any kind of situation that might arise in this county, whether it's a natural disaster, maybe not so much for this global pandemic, but emergency management coordinators all over the country have a set of plans. Our county has plans, an overall comprehensive emergency plan, which is made up of a bunch of little pieces in it. And we exercise those every year. We go over them. We have to sign off with the state on certain plans, and we exercise with the care facilities, the hospitals, and other organizations to make sure that, you know, we have things in place in case we do get hit with something. So emergency management plays a smaller role when it comes to public health emergency. You know, my job is to make sure that we have the plans in place, the resources, the who we can get a hold of if we need help, and stuff like that. Chris and I have worked together now for 3 or 4 years on some of this planning. And when this really started to go south here in the United States, I guess, we got together and started. We've been working on this. Chris has been working on it since early January, and her and I have been talking since February, before it even got bad here in the United States. Because that's kind of what we do. We plan ahead and we look ahead. But we decided to set up our Emergency Operations Center, which is basically a place where the information goes through. And we sit in here on a daily basis and have a game plan of what we want, what tasks we want to get done today, who do we need to talk to, what resources do we need to look at today. And then, you know, we put out a daily press release on information that some days it's not a lot that we get from the state, but some days it's more than we can put out too. So so we opened up the Emergency Operations Center. Her and I work together up here, and everything filters through here. So my role, you know, this is a public health emergency, not so much of a natural disaster, which is what we really plan for. So she takes the lead in, and I just help out and make sure we got the right resource and the right information.
Excellent. Excellent. Thank you, Brett. Really, we appreciate all that you do, and that you guys were able to get ahead of this curve a little bit. So
community partners, and we've been working with them. So it helps us out a lot knowing that them face to face, and Chris has said this many times, and you have to practice these things. Again, not level. We don't have a plan in place for a COVID response, but we use all the little pieces that we worked on to make it a lot better for our county. Yeah.
Well, I know that the county has been, our population's been really good about self-containing, and which I guess has kept our numbers low. And I guess my question for Chris would be, you know, about numbers. And I know that there are 4 positive cases in Jefferson County. And how many outstanding tests do we have at this point?
You know, the hospital is actually reporting that on a daily basis, and they haven't posted today's numbers. They post today's numbers. Sure. I would direct everybody to the Jefferson County Health Center's either Facebook page or website. Just a reminder, the local hospital or health center does not perform the quote tests. They don't run the tests. At this point, they collect specimens, and then those specimens are sent off to either the state hygienic lab or to a private lab. Brett might be looking, I don't know. I can't remember off the top of my head. It changes so frequently.
Yeah, and that takes what, about a week?
It depends. If tests go to the state hygienic lab, oftentimes they're resulted within 36 to 48 hours. I know that the state hygienic lab now is running 3 shifts of staff, and then still there's only so many tests that can be run at a time. So the more tests they're running, the longer it takes. I do know like LabCorp is a reference lab, and they're located in Iowa City, and sometimes it can take 7 to 10 days, again, depending. Brett just asked me his phone. Let's see. It looks like they're waiting on 2 tests to be resulted at the health center. Now, the one thing I want to just remind everybody is that the local health department is responsible to do communicable disease follow-up on all communicable diseases. So, and those individuals have to have a Jefferson County address.
Gotcha.
So, and not everybody at our hospital may reside in Jefferson County. Everybody that's being resulted. So you might see a difference or a variation in numbers.
Sure.
And our numbers at the health department should be reflective of the state, Iowa Department of Public Health numbers. The health centers may be off a little bit because they could have people coming from other counties for care. So I don't want people to get hung up and say, well, they're releasing the wrong information. They don't even know.
Really good point.
2 different things.
Yes, 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 because, the virus doesn't know county borders.
I
right?
wish it did.
I wish it did, because you're in good shape.
Yeah.
I know you have an important phone call in a few minutes that you need to prepare for. I just wanted to close with asking you, is there anything that you feel that, because people will be seeing this outside of the county since we are web-based, live streaming web-based, so people will see this all over the place. Generally, information for people. And then is this something that we can do with you maybe once a week to kind of get everyone updated on their current status?
It absolutely is. And Brett and I will be happy to get the information out. And I think we live in such I've been a nurse for a long time. I say that, and a lot of things have happened in the last 3 or 4 months that I have never seen in my 25 years of being a nurse.
Wow.
I've been through lots of different types of responses, but I have never seen a public health pandemic disaster declaration in my years of nursing. So like Brett said, it's different at this level, but preparedness is preparedness.
Yeah.
The key is to have great community partner relationships with anything. And I can't say enough about that for our community partners. I can't speak for other counties. I know that every county has a public health administrator. I know counties have emergency management coordinators. Some share an emergency management coordinator. From the Jefferson County perspective, though, I do want to say thank you for everybody that is working really, really hard to try to mitigate this. And I can't thank our volunteers enough that have been making masks, and now some people are stepping up making gowns. We've got people that have made face shields. So it is a community response, and that is the key to preparedness, because we know that you can't depend on the state level. You
Right.
depend on the federal level, because they're looking at 9 counties in the state. They're looking at 50 states in the union plus the territories. So it is a local effort and a local response. So,
And is there anything that you're lacking that you would like to call on the community to help with? You did mention masks, gowns, masks.
Brett, I think Brett and I need a vacation, but that's something that I think right now we're sitting pretty good as far as masks go, but we are reaching out to our other partners, our nursing homes, making sure that they have them for their residents, for the assisted livings, for the dialysis center, whatever. But if you still want to make a mask and donate, that's fine, because we know more that they're washed and how things don't last forever.
Yeah.
I want me sewing a mask because it probably would have already fallen apart. I think the thing is, we're going to harp on this. It's staying home, not hanging out with people if they don't live under your roof.
Right.
Order stuff online from your grocery store, or have it delivered, or go pick it up. Try really hard to not hang out with a bunch of people. It's difficult for me too.
Yeah.
It's very difficult because I'm a social person too.
Yep.
So we just ask that enough, and our business partners are doing a great job making some changes. There is new business guidance on the state health department's webpage. So if businesses have greater than a 10% sickness in their workforce, where they're asked to report that to the local health department. And schools have been doing that for years. If a school district or a certain school has greater than 10% of their student body out with an illness, they report that to the Department of Ed and to the Department of Public Health. So it's just for us to know what's going on in our community and how we need to help you with mitigation practices.
Fantastic.
I do know that I can speak to our health department. We're helping one of our, it's not a contiguous county, but it's a county that's not very far from here. It's one of our counties in our service area. They are inundated right now with follow-ups, and the official request went out yesterday from their health department to all of us in our area. So our nurses here are doing follow-ups for another county.
Wow.
That's how it works. Everybody gets together.
Yeah. We just make our tents bigger if we can. It's a very strange time, Chris. I really appreciate your time, your information, everything that you and your staff and volunteers are doing for us. We really deeply appreciate it.
Thank you very much for doing getting the word out for us. And Brett and I will do everything we can to provide the information. And we appreciate everybody being understanding and know that things change, and they change.
Yeah, thank you. And we'll be in touch next week, and we'll talk about those changes.
Great. Thanks.
Thanks, Brett.
Thank you.
All right, you guys, stay safe.
Thanks, you too.